there was a lot of back and forth before we put together this conference as to what we were going to present, because a lot of us have never given this talk before. So I give credit to Jeff for herding a bunch of cats. And as a matter of fact, I think, you know, herding cats is kind of what it feels like to work with these rare diseases as far as organizing things and making it come together. So I come at this from a slightly different angle, and as noted by the talk here, the challenges of establishing a sarcoidosis network. And some of the things that I think are special to sarcoidosis is that there are some public misconceptions. Some of these other rare diseases mentioned now are rare, but I think they're understood to be bad. You know, they're understood to be a serious problem for the poor patients that have them. But not so for sarcoidosis, as I'll point out. Also, I think there are challenges to creating your own network at home. I mean, first you got to have a network of individuals at home before you can think about networking elsewhere. And then the challenges of collaborating. I think some of the previous speakers made a really good point about how important it is to form collaborations with others and how it's a give and take. You got to help them if you expect them to help you. And then, you know, what can you do to kind of stoke the field? A lot of times in these small diseases, you find you're going to the same conference with the same 8 guys every time. You go, everywhere I was going is the same dudes, you know. It's like, you know, there's got to be more talent that we can bring into the pool here to help move the field forward. So I think that I'm going to try to give you examples of how to do some of those things. First, I'm going to point out that sarcoidosis is a disease. It's not infectious. It's not malignant. It's actually hard to describe to my patients. It's not autoimmune. We think antigens from the environment cause it. So it's really hard for anybody to get their hands on this. They don't know even how to describe it, you know. So that's a challenge. And then it's a diagnosis of exclusion. We have to think about all the other things it could be. And if it's not those things, okay, that's sarcoidosis. It's like a wastebasket diagnosis. And the onset is in adulthood, so a lot of times people, this isn't in their wheelhouse. They're not thinking of this disease. And lastly, it really looks a lot like some of these other diseases I just explained, and it delays their diagnosis. And even when the doctor figures out what it is, that a lot of times they don't know how to treat it or what to do next. So this brings us to this. I don't know if you watched this television show called House, where I'd like to have this guy's job. He's got 1 patient a week, apparently. But it's a very complicated patient. You got to figure out what's going on. You got neuro or something going on. And by the way, the number 1 differential in this show was, it always made me laugh, is sarcoidosis was always on the list. So if you're a student right now on medical school, just say sarcoidosis in your differential, and you'll get some credit for that. So one of the misconceptions is sarcoidosis is benign. It's a self-limited disease. In fact, the textbook says that. They're even messaging some of the organizations. The ACCP wants me to say this when I say this to people, and I refuse to do it because this is what I see. I see people that have a really bad disease that infects all of their organs, including the brain as well. So it can be very serious, and in fact, those people are disabled for their lives. They can live 20 or 30 years with this disease and have to deal with this on a daily basis. And this is a very important point to be made here, and I think Dr. Kissel made this point. Publish stuff. You know, if you observe something, this was from a study, the Black Women's Health Registry in Boston. It was nurses who were African American mostly, and they were followed for 12 years. And in that study, just out of the blue, this wasn't an intention of the study. They just said, boy, there's a lot of sarcoidosis in this group. 2% of them had sarcoidosis. Just to put this into context, asthma is about 5% prevalence in the population. So this is a very common disease among African American women, apparently. And if you'll see here, I'm not sure how to use the pointer here, but you can see the blue lines represent mortality at every age compared to those without sarcoidosis. And anybody that had sarcoidosis died at a much higher rate in this study. So, we were all, having trouble getting funding with the NIH, getting a foothold at the NIH. I went to the program officer. I sent him this study. And not and that had the biggest effect, I think. This one study that wasn't a sarcoid person had probably more influence on the field, as I'll get to in a little bit. So you got to first figure out, when you're thinking about whether you're going to do create a network, do you need one? You know, is there a reason to form a network? And I guess, you know, in this disease, sarcoidosis, I felt that there was a poor comprehension of the disease, you know, misconceptions. There wasn't great research in the field. There had never been a clinical trial funded by the NIH until 2014. We got one of them, and Vanderbilt got the other. Before that, no clinical trial funded for this disease. And part of the problem was there were no lab research models that accurately depicted the disease. There's no rodent model that represents sarcoidosis. So for a lot of reasons, the quality of the research wasn't great. That's part of it. And the misconception that it's not a bad disease to have. And then what also has to happen is somebody famous usually has to get your disease before something happens, right? So that did happen a couple times. And then the other thing that has to be happening for your local network generation is you got to make a living, right? If you're seeing a disease that is very time consuming, you can't generate any revenue from, that becomes an unfunded agenda for you. So that was a challenge for this disease too. A clinic full of sarcoidosis patients could take a lot longer than a clinic full of asthma patients, for instance. So the next thing I think you're addressing challenges in this disease would be, as mentioned before, do you have enough patients here to actually pull this off? If you don't have patients to see in your local network, you really can't be a contributor to the bigger cause. And do you have interested and motivated colleagues? And I got to say, I've had some fantastic collaborations here at Ohio State, because in some cases they came to me because, for instance, electrophysiologists are seeing people with these non-ischemic cardiomyopathies and arrhythmias that they're not sure what the cause of it is. Could it be sarcoidosis? And actually, it's on the top of the list of these non-ischemic, you know, idiopathic cardiomyopathy. So we're seeing a lot. I'm getting a lot of referrals from cardiology right now, and they're very motivated to help me out. And in fact, we're doing some publications that are leading the field, including Subbaraman's work with us on MRI imaging of the heart. So it's really been great to, if you find effective collaborators, that can drive your program forward, as mentioned by Dr. Catalan. And then the other thing I think that is important, it's one thing to see the patients and kind of take care of them, but I think it's also should be your goal to try to innovate on their behalf. A lot of times they're not happy with the status quo. They're coming to you and you're like, and I always felt bad at first because they'd come to me and I'm like, here's some steroids, here's some methyl. You know, I'm just giving them the same stuff that they can look up on Google and find. And what are you doing that's so special? What's this specialty clinic all about? So I think it's important for you to engage. This is an opportunity to engage with other sites, participate in their clinical trials, conduct clinical trials of your own, and then, you know, offer something different and better for your patients if you can. So the other thing that has been mentioned before is that you would like to integrate your program with national and international programs, and then, but you got to be strategic, I think. There are a lot of organizations you could try to, you know, make progress with, and a lot of times they're not interested in your disease, so you got to kind of be in there pushing pretty hard. So you got to pick and choose, but American Thoracic Society actually has a history of interest in rare lung diseases. Dr. Trapnell mentioned this, and sarcoidosis was always on their list of diseases. So we actually got funding from American Thoracic Society to do research at one time. American Association of Sarcoidosis and Granulomatous Disorders was actually a very small organization. It has those 8 guys I was telling you about were all on the steering committee, and we'd all go to the meetings, but nothing was happening. So we actually, you know, try to grow that program by getting NIH funding for the meeting and, you know, giving it a disparities kind of flavor. And that actually ramped up that, you know, that the attendance at the meeting was a record high in 2014 when we had the meeting here. The NIH sponsored it. They came here. They actually, through the interaction with that that group ended up having a workshop at the NIH where and from that workshop came, there will be RFAs coming to fund more sarcoidosis research. So I think these collaborations, if they're effective, can lead to big changes in your field. And the other thing I'll say is that you got to help and support these grassroots organizations that are trying to help, push the field forward from the patient perspective. There was this group in Chicago, which is incredibly effective now. It's one of those situations where one of the news anchors died playing basketball, famously on Channel 4 News, and autopsy showed it was cardiac sarcoidosis. He didn't know he had it. That's actually how sometimes they present, is a sudden cardiac death. And another wealthy business person, his wife had neurosarcoidosis, and she became the actual leader of this organization. And now it's become very influential, sits at the table with the NIH, goes to all these meetings. They have a patient advocacy meeting at every meeting now, and they ask us to come and do our rap for them. And it's been very effective for generating a lot of enthusiasm for a disease that 10 years ago nobody really had much interest in. So that brings us to what you can do to help them is to volunteer. So they called me a couple weeks ago. They had some 5K walk thing in Chicago. It rained the whole time. It's 40 degrees. But we went there and we did the thing and gave some. And it was, it's not a bad trip. I took my wife, had some, went to a show. It was a fun weekend, but I took an hour and a half to give a talk to them, and they were appreciative of that. So you have to, I think, give of yourself to these organizations. And actually, one of the patients in the audience wrote a book about sarcoidosis and his experience, and it was just one of the best talks I've ever heard. So it inspired me actually to be a part of it kind of revved me up to go to the meeting and hear from the patients. So I would say that it's not just for you that you do this. It's part of the reason we do what we do. We like being physicians because we get a kick out of helping other people. So it kind of keeps your career invigorated. So I think I mentioned some of these other things. The last thing I'm going to note is how do you promote the network's potency? Well, one of the things that you can do locally is to generate some interest is educate your peers. I gave grand rounds on this topic, and actually Mike Reaver was there, and he said, why don't you have a meeting, have a national meeting here on this topic? And that actually was the one I just described where, people came and NIH came, and that actually changed my, career in a big way, because now I actually went to the workshop and ended up writing the white paper that is being used to fund the next generation of sarcoidosis research. And honestly, I was a minor, just a regular guy in the field, but that actually propelled me by taking, as Dr. Kissel said, just take a leadership role, and people think you're in charge. So, and on it goes. So, this is actually from the white paper. Basically, what we are advocating for is to create a network that the NIH would run, because one of their complaints was the research that's being done in sarcoidosis is not reproducible. It's not representative of the sarcoidosis patients and phenotypes. It's all mixed up, and they're not randomized controlled trials. And of course, there wasn't enough funding to do it that way. So we're hoping that the NIH will actually do what they've done for other rare diseases, take this under their umbrella and organize the research nationally so that we get high quality research that guides the future and generates better therapies for these patients. And then I'll just kind of, before diving in, I guess I would say these things in summary. The first thing is, can you deliver the goods? Do you have the patients? Is your program poised to help? For instance, sarcoidosis patients need a neurologist, cardiologist. I need endocrinologists. I need all this. I need a team. Thankfully, OSU's got all that stuff. So I could just kind of find people who are wanting to see these patients and create a network here. And then the other thing is, you have to have some support from your organization. Like I said before, Dr. Griever, I asked him, can you give $10,000 if I have a meeting here, just in case I can't get it funded otherwise? And he said, sure. That allowed me to, some leeway as I was planning that meeting. Turns out we got extramural resources for it and didn't have to ask the department to help. But if he hadn't volunteered, I wouldn't have done it. So you got to have, some support from your institution. And then you got to be patient. The last thing is, it's kind of hard to get these things going. And at first, it's not very rewarding. It can be rewarding locally, but then these things take a long time to develop. And for you to make a difference in a rare disease is going to take a while. So be ready to persevere. But I think the positive feedback you get from these very appreciative patients is a driving force. And I'll make one other point, is it's probably a good idea to diversify your portfolio. For instance, while I was doing this kind of thing, I've also had a lab doing research in another area. So I was funded more in that area, and I've intermittently been funded in both areas. So it just kind of kept me going so I didn't die on the vine during the lean times. And then here's the network here at Ohio State, but I'll leave you with this little clever passage from Mark Twain. Thank you very much.